So I come from Cape Town, from an organization called Shonaquip, which I started as a parent of a child with disabilities. And we have designed many pediatric posture support equipment and rehab equipment. But during COVID, we found another issue. People living in very rural and remote areas could not leave their homes and travel to hospitals unless they were pushed in wheelbarrows carried on people's backs. The other option was blankets. So what we decided to do was build a product that could shift people's ability to access not only hospitals and clinics, but schools and other forms of services without the indignity of wheelbarrow transport. The problem is huge. We all know the numbers. The other problem is that most of the walking paths are single footpaths or bike paths or cattle paths, which you cannot manipulate a wheelchair on. So the solution for us was really to look at a product that could be carried over very, very rough and steep ground or sand, but also a product that could be pushed when there was a footpath or an area that was smooth enough. We've piloted this project in a number of different areas and had exceptional results. The transporter can be carried by two people who can then earn an income from doing this work. And the government has bought into the project and included it into their negotiations and policies around first and last mile transport. What we're really excited about is not only is this able to assist people with disabilities, but also people who are struggling with climate adversity. And the first project we tested this in was a flood. The result after the floods in KZN in South Africa, where all the bridges had been washed away, preventing people getting to their services. This then ended up being funded as a humanitarian emergency fund. And we wanted to make very sure in the design of this project that it didn't replace a wheelchair. A wheelchair, as you all know, is a really important posture support device, whereas this product is a transporter just to get you from A to B to public transport areas. Shonaquip has, in the last 30 years, assisted over 260,000 people with disabilities in terms of assistive technology. And the market for this product expands that even further to where there is a really tangible, serviceable market for us to reach another over 200,000 people just in Africa. The way we took this product to market was really to look at startup funding, which was driven by COVID and then by the flooding. We ended up finding ways to upskill and train the porters, so local community people, on how to provide first aid, how to engage with people with disabilities, how to transfer them into the product, and then move that through a process with government to look for subsidized funding for their transport needs. The porter income has become a big driver in securing funding because it's job creation for family members living in these remote areas. And I think for me, the most exciting area of this is suddenly now, not only are people with visual impairments able to get to church or get to the shops because they can be assisted to the road, but children can get to school. Shonaquip's model is a bit unusual. It's a social enterprise, a hybrid model that is made up of 3 entities, 2 not-for-profits who own the company, and all the profits generated are reinvested into the social impact agenda of these three organizations together. Here you can see the picture of the transporter attached to the back of a local public transport taxi. So we've designed this so that we can incorporate the transporter into the public transport system. And yeah, my team, as I said, we've been working for over 30 years making equipment, and we couldn't have done this without the most extraordinary team of designers, manufacturers, production staff, technicians, therapists. We've got a large team that does outreach across South Africa and into 7 surrounding countries. And we are also using that team to assist with policy work and supporting our partners, CHAI, and other service providers in the region. Thank you very much.
Thank you.